So there are some people that for whatever reason, past trauma, they need to have this constant medicalization and testing done. Home birth is not going to be for you. That's just not going to be a good fit. If you're afraid of having your baby at home, you should not have a home birth. But still, I think we can say most people start off their first pregnancy as good candidates for home birth. And unfortunately, a lot of people wind up in the hospital for their first delivery, and that changes the outcome for everything. Because, like you were saying, the way that you're treated when you're pregnant with that decision making and that trust that somebody's giving you, that you know what's up with your body and your baby, that translates onto everything for the rest of your life, or how you parent, how you make decisions about your health going forward.
Welcome back to the Kumbay'all podcast. We are so excited today to be joined by Missi Burgess and Tanya Trail, two local midwives in the Atlanta area here. And I specifically asked them on because I have had this conversation so many times with my in-person patients. I had 2 home births. I know you both know that. Rebecca has 1 child and she had her at home as well. And so when I talk about that with my patients, I'm really open about that, right? And I love that I had home births, and a lot of our friends had home births, and we're very supportive of home birth. And I've had a few patients now say things like, well, did you have, after a while, we're talking after multiple treatments, and I could tell they felt comfortable asking me, and they would say, oh, well, did you have prenatal care? And like, what did that look like? And, were you in your house? And so I feel like I'm in a little bubble that I know what home birth is and how wonderful it is. But I feel like there are a lot of people that don't. And it's either you're in a hospital and you're screaming attached to machines, or you're in the forest giving birth in a river, right? Like they don't understand like that middle ground and what home birth can be. And so that's why we really wanted to bring you guys on and kind of talk about all the things and just clear up some misconceptions around home birth and help paint a picture, an accurate picture of what it can be and what it is. So yeah, I say, let's start there. If we ask you both, and you can answer separately if you want, but let's describe a little bit of what home birth is and what home birth isn't.
So I will say, I started in 2005, started my midwifery education process. And at that point in time was married, started having my own babies. But my partner at the time, his question to me was, what does your clientele look like? Is it all farmers? There's this misconception of the education around home birth, what it is and what it's not. And clientele that comes to home birth comes from all different facets of education and outlook. It is not just crunchy granola moms, it's not just farmers, and it's not just, neurologists and highly educated peds. It is a process and a journey that one goes down to figure out what home birth is and if it's the right fit for them. And so home birth, just as a quick synopsis for me, it is more of a concierge prenatal care that treats preventatively, that looks at nutrition, exercise, the overall health of mom going into the pregnancy and throughout the pregnancy, while regarding that prenatal care of the baby's growth and those appropriate markers we're looking for in pregnancy, all ending and culminating in this beautiful delivery at home. And so, with that, the education that goes into your midwife or your birth professional is, very extensive so that we can handle all those different pieces. It's mental, physical, emotional. All those pieces fall into having a healthy home birth. And so, home birth is a much more concierge approach to that prenatal assessment to end up with that birth that we want, if that makes sense.
Absolutely. Yeah, that's a great description.
I would add to that I kind of like was trying to make like a mental running list of like what home birth is not, because there are so many misconceptions about it. One of the things that I think that I hear from my clients is that when they tell people that they're having a home birth, everyone immediately thinks unassisted. So the response they usually get is, "Oh, so you're just going to like do it at home by yourself?" And you can do that. That would still be a home birth, but typically it's attended by somebody that's trained in childbirth with some education and experience and handling emergencies that might occur. So it's not by yourself necessarily. I think home birth is also not always water birth. A lot of people hear home birth and they think you have to do it in the water. And I get that question at consultations sometimes. They'll say, "So do I have to have my baby in the water?" No. Just at your house or in the vicinity of your house even, I would add, because it doesn't always mean that it's inside the house. And then I would also say that home birth is peaceful, but it's not always quiet. And people tend to think of home birth because of the videos that they've seen on Instagram or YouTube or whatever. And they're thinking that it's like this, like beautiful, like I'm just breathing and a baby emerges and there's twinkle lights. And sometimes there are those things. Oftentimes there are at least the twinkle lights, but there's usually a lot of like guttural noises and shouting. And there's nothing wrong with that. That's just normal. And I would still call it peaceful.
That's so great. That's amazing. And I agree with both of what you said. And I think that's such a good point that really, when we say home birth, it's not just, okay, someone shows up and they're really experienced and educated in helping you have your baby at home. There's the prenatal care. That concierge prenatal care is such a good, important point of it. And I know that is also what helps lead up to a successful, being able to birth at home, is the care that you provide and that that experience, that knowledge. It gives confidence and it gives assurance to the parent, both parents, I would say, that this is good, this is normal, we can do this, and you're not crazy for wanting this. I mean, could you talk about that maybe next? Talk about the role of the midwife and what you do for your home birth clients.
I think the most important thing that midwives do is we work from a philosophy that pregnancy and childbirth are normal physiological processes. So just starting on that foot, we are going to approach everything uniquely because we're not looking at things like we know there's a problem here, we just have to find it. There may be a problem, we may find it. We do a lot of work to prevent problems, so oftentimes there are no problems. But I think that's the most important thing, that we're not looking at it as a medical event or something that needs to be fixed or even managed. We mostly facilitate. So we facilitate what's already happening in the woman's body and in the birth process itself. And sometimes we can gently re-navigate the way that something's going, but we're not doing a lot of strong arm forcing things to occur. So midwives working from that philosophy, we do also offer regular prenatal care, which is, like you said, a question that people have a lot. But our visits are going to be much longer than what's normal. We see people for 45 minutes to an hour. We offer all the standard tests usually that most OB offices offer, but we're not going to require them. So it's a lot of conversation with people about what their risk factors are, whether or not they want to test, what are they going to do with the outcome of this test, things like that. So it's a lot more education and working together with the person that's pregnant. Oh, the other thing I would say is that midwives know normal. That's what we're trained in. So we're mostly just, like a bank teller that just can feel money really fast. When something's not normal, we're going to know pretty fast.
I think from my end, to add to that, I think where Missy's talking about testings and all of those things, it's not a mandated situation or where you walk in and you feel like you were presented with a test option and this is what's being done to you today. Within that home birth model, for most of us, we are providing you with the information of what normalized hospital birth care looks like, what testings would be done for you to be digging through that information, doing that research. I like to tell my families, planning for your birth, planning for those options that come up throughout the pregnancy are step one into what parenting is going to feel like. You're going to constantly have people offering their opinion of how you should parent and raise your children. It's up to you to determine what options are right for you and your family. And so my job as the midwife is to support you in those decisions and let you know when that makes me uncomfortable or steps out of the variations of normal that we see. I think also normalizing with women that the complaints that they have in pregnancy that they have been told are normal that pregnancy's uncomfortable, that they're supposed to feel uncomfortable, that midwifery model kind of digs a little deeper into that because you're not just coming in telling me you have headaches. And I'm like, oh, you probably need to drink more water and sending you out of my office. We're looking at some of those deep factors, such as where your iron level's at. How often are we eating? What are our blood sugars doing in response? And we're kind of dialoguing through those things. Oh, I'm having sciatic nerve pain, or oh, I've always had this constant pain in every one of my pregnancies. Well, this pregnancy, let's make it different. What can we do to help facilitate the body being in a healthier stasis while growing that baby? So, pelvic floor PTs come in there, chiropractic, those sort of extra elements. And because of those long prenatals, we have that time to really sit through that, let alone the emotional triggers, whether it's in your day to day life or the things you brought into from previous births or from previous, relationships with parents or your ideas around birth. You're really able to take that time and go through those things.
That's amazing. Yeah, it absolutely is. You're knowledgeable about and you're able to touch on and guide and offer support in so many different areas that I think women don't get in a more traditional hospital model. So that's amazing. And I think the empowerment is so huge too. That was so profound what you said. And I completely agree that how they handle birth and how you're helping them navigate making those choices for themselves and even really allowing them to have that position of okay, this is a choice, this is you could do this, you don't need to do this, and you need to make that choice for yourself is so empowering. And then like you said, they're going to head into parenthood and have to do the same thing, realize that there are going to be a lot of people talking at them and they are the ones who are raising those children and they're the ones having to make the decisions for themselves. I love that. And I love the time, the extra time. I mean, I just love everything about the midwifery care. And my mind immediately goes to, and I know the answer, but I want to have this discussion about like, can everyone have a home birth, right? Who are there some people that are better for home birth or are there's, and that's not a good way to say it, but is there anything that would make you say, okay, I think you would be better to deliver in a hospital or you'd be better served, not having a home birth. I think everyone should give birth at home. And I know that's not the case.
I wish
I
that
think, oh,
everyone could give birth at home, for sure.
exactly. I think we all want that.
Yeah.
Yeah.
But,
Yeah.
when I first started this work, I think the statistic we were saying was 90% of women are low risk. I think it's less than that now, if I'm honest. I think COVID changed some things. Our lifestyles are changing, more sedentary, things like that, that's leading to more health problems in the general population. But we like to say that home birth is good for low risk people. So that would be somebody that doesn't have heart disease or diabetes that needs to be managed with medication or, a real extreme hypertension. Home birth also is not for people that aren't working from or willing to work from the understanding that what's happening in their body is normal. So there are some people that, for whatever reason, past trauma, ignorance, they need to have this constant medicalization and testing done. Home birth is not going to be for you. That's just not going to be a good fit. If you're afraid of having your baby at home, you should not have a home birth. But still, I think we can say most people start off their first pregnancy as good candidates for home birth. And unfortunately, a lot of people wind up in the hospital for their first delivery, and that changes the outcome for everything. Because, like you were saying, the way that you're treated when you're pregnant with that decision making and that trust that somebody's giving you, that what's up with your body and your baby, that translates onto everything for the rest of your life, or how you parent, how you make decisions about your health going forward. Yeah, everything.
And how you
Which is
trust
why I think,
yourself.
Mhm.
right. And I think that's why home birth has been associated over the years with the crunchy granola, and I'm just going to use that term women, right? Where it's like, oh, you're eating all organic and you're wanting to grow things on your own farm and you're wanting to do the reason why I think we're associated that way is because of the amount of investment you take towards your health and your birth, kind of run in a similar vein. The women who are going to research where their meat comes from are the women who are going to research how they want to have their baby. Now, I have had mamas who have wonderfully healthy pregnancies, and I can honestly say I know they were eating Taco Bell and drinking a Mountain Dew once a day. I mean, we have all those different variants. We have, it's about maintaining a healthy pregnancy and what your body can do. One woman's body is capable of doing that and still maintaining and growing a perfectly healthy baby. Now, big on protein, getting that protein consumption in there to do that. But they're perfectly capable of doing that. Whereas another woman that would challenge her entire body throughout pregnancy in that spaces. And so making sure that, women kind of have that general approach to health is very helpful to keeping us home. And so that is our main candidates. I think one of the big things we're running into in home birth that was not as much of a factor 15 years ago is the amount of women on prescription medications coming in. And so there is that evaluation, right? There's a lot of things we can be taking, but then there's some things that just relatively show that, yes, we're going to be better placed in a hospital situation based on how we entered the pregnancy. But once you're in the home birth, low risk arena, very high success rate of
Right.
maintaining good, healthy pregnancies.
Yeah, excellent. Love it. And now thinking back, we briefly touched on water birth and how some people think home birth is water birth, and we know that's not the case. But I'd love to dive in a little bit into what is water birth. Is it safe to have your baby in water? I honestly I can admit to this when I first heard that people had their babies in water, your brain just goes off like, no one does that. That's not safe. That it was just kind of a weird resistance that I felt. And then when you think of it, duh, they're in water. I'm not water, but they're in your amniotic fluid. They're in that state. I mean, it just didn't seem like so much of a stretch when I actually critically thought about it. So, and now I've come full circle, but I'd love for you to kind of dive into what water birth is and, how it's safe, is it safe, things like that.
Mhm.
I'd love to lead with the story of a mom I had. That was her ninth baby, first home birth. She got a pool. She's in the pool. She looked at me in that labor all of a sudden went, what in the heck have I been doing all this time?
Mm. Yes.
So the logic behind water births, first and foremost, and why so many women want to gravitate it more so than it just looks really cool, is the fact that that warm water and that ability to relax the muscles around the uterus are so helpful in managing labor. It just allows, I like to joke that I am a very A type personality. For me, it breaks up a timeline. I know that at this point, I'm calling the midwife and she's coming. At this point, I get to get in the pool. And at that point, the baby comes out. Right. And so it breaks up that monotony of just that process of contractions. I hate AMRAPs. They're not my favorite. And so that just breaks it up for me. But when it comes down to it, that muscle relaxing that happens in the water is so great for mom and that ability to move through those contractions and get actual rest in between. So that's why we're using water in birth, not just because it looks cool to see babies come out in the water. In
Mhm.
fact, I will say, and Missy might have different stats, but when it comes to our first time moms, a lot of them labor in the water, but maybe don't find the muscles for pushing out a baby in the water. So the goal is not really to just have the baby in the water. The goal is to use it as a tool of management to providing extra comfort through that labor process. So that is what labor is for in my mind. If Missy wants to talk about the transition of babies through that process.
I would love to. I would add, I had 4 out of 5 of my babies in water, and the 5th one just would not come. I think it was because I had the wrong color birth pool, because this was
That
back
was it.
before they were selling birth pools to the public, so I had a kiddie pool, and I had the blue one for my first 4. It cost $17 on Amazon. Now they're like 100 plus,
Yeah.
and, we popped it because we also used it as a summertime pool for the kids. And so I couldn't use it for the 5th one, and I had to get a different one, and all they had were these white ones, and I was just like, could not picture it happening. But then also, my 5th child was asynclitic, meaning his head was just tilted wrong, and so every time I got in the birth pool, my labor stopped. And so finally, they were like, "For real, this time you can get in," and I was like, "Absolutely not." I will not get back in that pool. It's been 3 days. Just, I want my baby to come out. So he was born on the bed. It was very different. I felt like that ring of fire that people talk about. I felt that very differently for the first time. So I did really appreciate water birth. But I think you could like maybe think of it more like hydrotherapy than water birth. Like to Tanya's point, the whole thing is that it's going to do about like maybe what a narcotic would do. It's going to take the edge off and help somebody relax. And there's also this thing where there's like truth and a little bit of a misconception about getting in the water too soon. So like if the midwife, am there, I definitely do not want somebody getting in the water too soon. That means it's
Mm.
going to slow their labor down, right? But sometimes in early labor, you do need to get in water to help yourself relax because the relaxing is what facilitates the labor to continue. And so a lot of times we will tell people to get in the bathtub. And then they're afraid to do that because they say, well, what if I get in the bathtub and everything stops? Then go to bed, take a nap. If everything stops, it's not time now. It's not time for us to get all excited and worked up yet. So, water is just this really great tool of helping you see where you're really at in labor when you're not sure sometimes in early labor. And then for the birth itself, my goal, well, my personal goal, because Tanya and I are the same person, in case you didn't know, in a lot of ways.
You needed more diversity in your midwives.
Sorry.
We have diverse experiences, but we're very similar.
We do. We
When
do.
I was giving birth, I also developed after my first birth, and except for my fifth, the other three, it was okay. I'm going to get in the water, and in 2 hours, my baby is coming out. And I would let everyone know that, okay, I'm not getting in the water yet. It's not time. 2 hours. Okay, 7 a.m. I'm having this baby at 9. And then I would do that. Not everybody, it doesn't always go that way, but it sure did for me. But I think if people can be in the water for transition, that's the most helpful time. So the baby coming out in the water is just kind of like, sure, if you're there and you don't want to move, then let's do it there. But it's not necessarily the goal. And as far as the safety goes, there is so much data on home birth being just as safe as a birth on a bed or a couch or a floor or wherever else. So when the outcomes are so similar, really all we have is like case studies to look at of how safe is this. So we have a couple of case studies of like infection occurring, and those were all hospital births where there was actually like a systemic problem in the hospital waterway itself. So it's not really applicable to us and to most hospitals, really. And then the other thing that we have to look at is like rates of tearing, like perineal tearing and things like that. And some studies that you look at show that you're less likely to tear. Some studies that you look at show that you're more likely to tear. So it's really kind of the same for all of that kind of stuff. And then the only like case studies that we have for injury to the baby would be like, we've probably seen some of these videos where it's like sometimes there's like a free birth and they're just like letting the baby swim around under the water for a time. And we don't do that. We don't recommend doing that. And there have been people that have done things like that and it was not safe. But for your average, we're having the baby in the water, there's a midwife there, or maybe we're not comfortable with the idea of holding our baby underwater, things go great.
Mm.
You were talking about the baby's transition is in fact true. The baby, when it's in the womb, is in water and their lungs are already full of fluid at the time of birth. So the first few breaths that they take, they're not actually taking in a lot of air. It's their lung tissue is absorbing that fluid that was already in there. So when they come out into the water, there's not really anywhere for that water to go. They already have fluid in these spaces.
That's an interesting point. Yeah. Well, and
It's already full. Like you can't put more in. It's there.
Yeah.
right. And I love when we did that home birth course together or class together that Saturday, where you were even teaching the parents, okay, if dad wants to catch the baby and you have your baby in the water, how to bring it up,
Mhm.
In the best way possible. So you're not just going to
Yeah.
bring the baby up with a face full of water. So when they're trying to
Right.
take their first
Yeah.
breath in, they're getting a whole bunch of water in their
Yeah.
mouth. So
Yeah.
yeah,
It's kind of a
there's,
Well, and,
kindness, just flipping them over first.
yeah,
and that's part of just from a joking standpoint, but also very real. It is much easier to facilitate maneuvering a baby underwater. There is a great aspect being able to move that baby around. If there's cord involvement, it just feels with your hands on there, it feels so much easier to just get that baby moving and into mom's arms in a much simpler way than those lovely slippery little guys as we're squatting over a tile floor.
Yeah.
And
Yes.
so there's that great element of that. And it looks cool. So,
Yeah.
social media, important.
Exactly. But Missy, it's funny. Your experience was my experience. It was 2 hours. I got in the water. I
Mhm.
rested for like an hour because I was like, "Oh, this is glorious!
I
This is
know.
so amazing.
Yeah.
I can rest." And then my midwife was like, "Okay, you're gonna have to start working again." Do I have to? Are you sure? And then so it was 2 hours after I got in the water, my baby was born. I was like, "Okay, that's good."
Yeah.
So
Great.
yeah. So I'd love to next talk about like some tips or tricks or thoughts you have about how women can assume a woman is a candidate. They're low risk and home birth would be an option for them. What are things they could do to help them have a successful home birth? And if you have experience with women who, like you said, have maybe have had to transfer, or maybe you didn't have to transfer and were able to have a birth at home. Because the other thing I think that people don't understand is just because you start off wanting to have a home birth and going that way, it doesn't necessarily mean that you will get to have your baby at home. There may be things that
There's no guarantee.
there's no guarantee. So, what can you do to help increase their chances of being able to deliver at home?
So first babies, your team is vital.
Mhm.
Put it together well. I think consecutive babies, I could speak to that in a minute, but that first baby, knowing, having an educated provider is important. I think having someone who really knows how to approach decent prenatal care and that medical facilitation around birth is key. But doulas, childbirth education classes, knowing who your support team is within your own surroundings. Not always is our family our largest support team when it comes to home birth. And so being selective in what you're bringing into that arena, whether or not you're using chiropractic, those sorts of things, but really educating yourself because the more you demystify birth, the less fear that you put in place in birth, the better the outcome. Live in a society that doesn't talk about birth that way. We hear the scary things. We hear the negative outcomes. Every stranger in the grocery store will see your belly and tell you their horror story. We do not tend to have a message of passing down positive birth stories to our women. And so a lot of women grow up without hearing about birth. And then what they have heard was bad. And so putting together a team that really brings in that positivity of what it truly is and takes away that fear. I like to say a lot of people choose home birth because it puts control back in their hands. You are in something that you have no control over. You have no control over when you're going to go into labor. You have no control over how your body's going to respond to labor. And so there's all these elements that feel foreign and out there and create a fear-based environment for individuals because we like to be in control. Sometimes bringing it and putting it into that home birth environment for a lot of people makes it feel like they've at least got their hands on a piece to where, and so looking at a team and knowing this team has my interest at heart. This team knows what I want for my birth. This team knows that it's not home birth at all costs. It's home birth when best for me and my baby. And so when the recommendations change, my plan changes, but it takes that fear out of it and puts a little bit of control into something that doesn't have much of any. Now, your consecutive babies for mamas who have previous birth trauma and really want to work through that, things like that. I think birth counseling is great. A lot of that's happening in the prenatal room. Sometimes it needs to happen somewhere else. There's different elements you bring in when you've already had other babies, but I think that team starts to look a little different than that base intro team that you had for that first birth go round when planning a home birth the first time. So it starts to look a little different. You have your moving pieces that are important to you, or maybe something was missed. A mama who ended up with a C-section, and again, just referencing back to you guys because of those pelvic floor issues, and gets a lot of resolve in that next round of prenatal care and is able to push a baby through those muscles and gets a lot better response. Those sorts of things. And so developing that team around those specific needs, those consecutive babies becomes a little bit different.
Anything
I
you'd
think
like to add?
another thing that helps, one thing that I've noticed is working on your ability to surrender to because you do have a lot of control, but there's also a lot of things that you don't have control over. And I think sometimes when a person is really anxious or nervous, like say they're worried they're going to go past their due date, or they're worried their labor is going to be long. Sometimes those tend to be like self-fulfilling prophecies of sorts, where you're spending a lot of time getting nervous and anxious and worked up instead of just surrendering to what you really don't have control over. You don't have a lot of control in some ways over when you go into labor or how long your labor is. There's definitely things that you can do that affect that. But sometimes you can do all those things and you still go past your due date and you still have a really long labor. But that mindset of surrender is what you really need for a natural childbirth. So finding ways to work on that in your personal life, but then also just in your mind when those concerns come up, of just letting that stuff go that you can't control. I've noticed that the clients that I have, that mindset comes a little easier for them, they tend to just have their baby.
Mhm.
So that's just one thing. And I'm not great at surrendering, and I had all 5 of my babies at home. So it's, again,
Done.
one
Yeah,
of
there's
those
hope.
things. There's no perfect way to do it. My midwife always said to me, "Do you know crackheads have babies? Like people are doing crack and then a baby comes out anyways." It was just her way of telling me like, "Relax a little. It's okay that you ate an Oreo," you know?
Yeah. Yeah.
I'm a solid A-type personality, and my longest labor was 5.5 hours. They say those of us who have a hard time putting down control tend to be the ones who run into those risk factors, but for the same reason.
Mhm,
I know my only way out is through,
mhm,
Mm.
and my only way through is to let go. And
mhm.
so the second I recognize I'm in labor, it's a let go process, and usually my babies are out within an hour of that. Like the second I've really
Wow.
put the pieces together, and I'm like,
You're like,
this is
I think this is
labor.
happening.
Oh,
Mhm,
okay. And so
Mhm.
my labors are fast for that
mhm.
reason. And again, lucky in some ways, because it's not always the case. Sometimes you can do all the work and still end up with a different outcome. You have a baby with an asymptotic head, and it wants to do its own thing before it decides to come down. It's not uncommon for them to enter that way, but a little uncommon for them to want to stay that way. And so, sometimes you've got a stubborn baby. Sometimes it's something going on with your pelvis. And sometimes it's other pieces, but we can do our pieces the best we can and learn how to navigate those on the front side.
Those are incredible suggestions and advice. Thank you so much. I think
Yeah.
that's so great.
Love it.
Yeah.
Love it. Well, we want to honor your time and not take all of your time, although we could chat about this all day.
Thank you so much.
Are there
Yeah.
any other parting words or things that we didn't cover that you'd like to cover?
Or tips, encouragement, any of the thoughts you'd want to leave
Yeah.
women with.
Hmm.
I'm going to say we are not doulas
Oh, yeah.
because we did not touch on that. My sister, I've been a midwife for 15 years, has 6 years of education, spent a ton of time focused on this. My sister called me the other day and asked me if she could give somebody my phone number because their doula was pregnant and they were going into labor and they were needing help. And I said, with what? So doulas are emotional support individuals. They are vital to birth
Mhm.
situations and having that support, but they are providing a physical and emotional support in a very isolated aspect. Whereas midwives are medical professionals that have been trained for years in catching your baby. Now, we say we're catching, not delivering, but it's still a process. And so I think it's a common question. People don't know the difference. And so know what a midwife is, know what she provides, know what she brings to the table.
Yeah,
And
I
that
think to that point, like when you're trying to find a midwife, there are some things that people can ask themselves to like try to figure out like which midwife is best for me. Like some people need space to make their own decisions, and some people are going to want a lot of guidance. Like maybe they don't know anything and they don't know what they don't know. And knowing that about yourself and communicating that to a potential midwife is going to help you figure out like, is this person best for me? Because there are some midwives out there that are a little bit my way or the highway, unfortunately. But it's just a thing, they exist. And it would be good to know that before you link up with them, but then also some midwives just maybe you just need to tell them like, I need a little more information. I need some guidance. I need you to be more hands-on. I've had clients tell me like, I want you to tell me when it's time to push, because I don't do that automatically. I just, most midwives, if they're pushing, we're just like, it must be time to push. And if they're not, then we're thinking it must not be time to push. So knowing that about yourself and then communicating that to a potential midwife candidate is going to be important because then they can kind of let you know, like, I'm not the midwife for you. I've told people that before. I can see that what you need is not, I try to be flexible, but there's some things that I'm just not down with. And so you need to pick somebody else if that's what you want to do. Also knowing like, do I need to know who my birth team is ahead of time? Some midwives, you're going to just get them. Some midwives, you're getting them and an assistant that you may or may not know. Some midwives, you're getting them and a student and you've seen them the whole time. Just knowing that about yourself, like who do I want in my space and how many people do I want in my space? And then when you're talking to a midwife, asking what their training was and how long did it take? Because you can't just ask what it was because it could be, well, I had an apprenticeship. Was it a month long? Was it 2 months? The standard is 3 to 5 years. It should be a 3 to 5 year apprenticeship, or you have nurse midwives who have gone to nursing school. So they didn't get training in out of hospital birth. And so those are important things to be asking when you're interviewing a midwife is what was your training? Okay, what was your experience? How many births have you attended as the primary midwife? Not just how many births have you attended. It could be 1,000 if they were a doula for a long time and they've been the primary midwife at 25. So getting kind of specific, these are the things that people don't know that they should be asking because somebody's calling themselves a midwife. We just assume that they know everything. So those two things are important. And then also like, what have your outcomes been like? How many of your moms transfer during pregnancy? How many of your moms transfer during labor? The national standard is that about 11% are going to transfer during labor. That's someone that's practicing relatively safe midwifery, honestly, because not everybody is going to stay at home. Have you ever had a bad outcome? Have you lost a mom? Have you lost a baby? What was that like? I also find it really challenging and insightful when a potential client asks me, what's a difficult birth that you've been to? Because that's like a level of, they're asking for like a whole nother level of vulnerability, which I'm here for. So I just think that's a really great question to ask because you're going to get an idea of how does this person respond to adversity and what's their relationships like with their clients and how did this go? Have they been tested and challenged? Can you think of other questions to ask potential midwives? Oh,
I
what might
think those are
be out of your practice? That's a good one too.
What was that question? I didn't hear that question.
What might risk me out of your practice? Like what might pop up during my pregnancy that would indicate that I shouldn't have my baby at home?
what do they carry? What are they capable of? Suturing is not my favorite. It's my biggest joke as a midwife. It's what I'm known for is my uncomfortableness, but I can. Are you capable of hitting these things? What is intimidating to you about these factors? I show my intimidation very easily about what makes me uncomfortable or not. And so knowing what your midwife is capable of providing and what she is bringing to the table also, because there's a lot of responsibility on mom for what the work she's doing throughout that pregnancy on what to carry, but also just whether it's even just prenatal, that prenatal nutrition aspect, being well versed. What's important to you? I have clients who come to me because they know I'm an ex-competitive CrossFit athlete. So they go, well, fitness is the priority for me in my pregnancy. And I want to be with someone who respects the fact that knowing what I can and cannot do. Now, I am not their coach. I am not a personal trainer to my clients, but what I am able to do is relatively look at what's safety within what they do. And so knowing what we provide in that, so whether it's things we bring to your birth or things that we're able to do prenatally, those are questions that I think are pretty important of your midwife too, for what your priority is.
Mhm.
And I do love the questions about what was your education like? How long were you apprenticing for? How long, what school did you go to? Because I do know there are some people that make it seem like they're a midwife and they're not a midwife. So I want everyone to just make an educated decision and know who they're hiring. Yeah. To get the care that they're assuming they're going to get. that level of care like a midwife would provide. So I really appreciate you bringing that up. Great, great, great.
So I'd love for you to share with our listeners how they can find you, work with you. I think you're both in the Atlanta area. I don't know if you see people outside of the Atlanta area, but all the information would be great.
I am in Lilburn and I go in a 1 hour radius, but I would love for it to be 30 minutes.
Right. And this is Missi, if you're listening to this. Yeah.
I'm mostly I do Instagram sometimes. It's Missi Burgess Baby Catcher is my Instagram, and my website is homegrownbirth.com. Yeah, that's me.
Wonderful.
I swear I was baby catcher first. But that's my personal Instagram, so we're not interested. I'm
You're right.
Tanya Trail. I am currently in Tucker, but moving to the College Park area, trying to facilitate that south of 20 environment a little bit more. And so I am going an hour to an hour and a half radius, depending on location. You're coming to me for prenatals, so there's an investment of time and energy. So I am laboring hands midwifery, and my Instagram is laboring hands.
Thank you again, both. You're both so amazing. This is a wonderful conversation. We really appreciate it. All the knowledge and wisdom and you've shared is so great.
Yeah. Just what I wanted and more.
Yes.
Thank you.
Excellent. Thanks so much.
Absolutely. Thank you.
Take care.
Are you nervous about the pain of childbirth? If so, you'll want to check out our free Birth Mindset Mastery Move training. You'll discover the one simple move that's the best way to prepare for the pain of labor. This is Amanda. I did this move throughout my second pregnancy, and it's what I teach to my private patients and what we teach moms in progressive pregnancy. It can help you build confidence, increase your pain tolerance, and prepare your body for a more positive birthing experience. To get access today, go to progressivepelviceducation.com/birth mindset mastery.